Discovering a translocation in a family makes it necessary to think about other family members to see whether the translocation has travelled through the family for several generations. Tracing those family members can present particular counselling problems. Selina, Dominic, nice to see you again. We talked briefly before about the translocation running in the family and how it explained how David had been born with multiple birth problems because of that. I explained to you about translocations, and Dominic, I explained that you carried this balanced rearrangement or translocation. I'd like to talk now about two things. First of all, your own opportunities for having another baby, because a bit more time has passed now, and I think it's time for us to think through these issues and also to think about the implications for the wider family. So the first thing is to say, you remember I told you there was a 50-50 chance each time you achieved a pregnancy whether the baby would be affected or not. You could just take the chance, or we can do a test and scan and do a sample in pregnancy and find out whether the baby's got an unbalanced set of chromosomes. How do you feel about that?
We talked about it, and I think that going the route of the test would be the best thing to do.
Okay. Dominic, do you feel the same?
Yeah, I do. I'd rather take that route because it feels more natural.
The one thing that I will mention, although you probably just put it aside, but just so you're aware of it, I know that you've had a lot of pregnancies and not succeeded, and you're keen to get pregnant and have a baby. If you have any problems achieving pregnancy, or if you have any second thoughts about testing in pregnancy, the other option you can opt for is something that you wouldn't naturally think of, and that's sperm donation. So we normally use that as a treatment for couples who are infertile. But of course, in this situation, if you were to achieve a pregnancy with a donor sperm, then you would avoid the chromosome problem. Now, most couples don't go for it, either because the dad, thinks, the only thing I do is kind of donate the sperm and phone to say what the baby weighed after it's born. So if you take away the sperm contribution, you're not really the dad. But of course, you are the dad in every social sense. When the baby's born, you are signed up as the father of the child and would be raising the child. So it's a bit like adoption in that sense for the father. But it does allow you to achieve a pregnancy without all of the trauma and risk of further terminations or losses. The other thing that puts people off is just the thought of doing it. It sounds rather unpleasant. It's actually just like having a cervical smear, which I'm sure you've had done already. And it's just you go to the gynecologist, but instead of a smear, they actually insert the sperm sample into the neck of the womb at a time when you're ovulating. So that's an option, okay? And I'll put that in my letter to you just so you can think about it. And if you want to learn more about that, I can refer you on to the gynae clinic to talk about it.
Okay.
But otherwise, if you want to just go ahead and try for a pregnancy, we'll see you in our clinic with the obstetric team as soon as you achieve the pregnancy and scan you and then organise all the tests from then on. The other thing most important that I want to talk to you about is that I said last time we spoke, Dominic, that this was something that was present when you were conceived, but of course it could be that either your mum or your dad carried this rearrangement. Now of course they are no longer alive, so we can't test them. But I know you've got a sister when we took the family tree before, so there's a possibility that your sister is a carrier of that translocation. So what I'd like to do, with your permission, is contact her and ask her if she'd like to send us a sample.
I don't speak to my sister.
Okay. Are you in touch with her at all?
No.
She lives, I think, in London, is that right?
Yeah.
Do you know where she lives?
Yeah.
I mean, how would you feel about me just dealing with it and writing to her myself? I mean, you don't need to be involved.
I don't want to have any. I'd rather not know.
You won't be anything to do with it, though, will you? This is.
Yeah, but I
This
don't.
is just for.
But this
Professor
is all
Byrne to
confidential, isn't it? From our point of view, and I don't want to include her in it.
She probably wouldn't even know you'd been involved there, would it?
So what do you mean?
Well, I mean, if you tell me where she lives and what her address is, then I can write to her and just get her GP to send us in a sample.
I'm sorry, we don't talk at all.
I don't see what that has to do with it, though. I think it's only fair if she's privy to this information.
I'll talk about.
I don't talk to her either, obviously because of Tom, but it may well be the case that she wants to conceive a child, and it's important.
You can see our dilemma in a sense, because you're my patient, and you're the person I look after, but obviously in a genetic clinic we have to think of the wider family, and so
we're not like a normal family though. Yeah.
Okay. I'm sure, and it's not uncommon that people have issues, and there are other, reasons why they don't want to talk to each other.
I just don't understand why you don't want her to receive this information.
Because you know what it's like between me and her, and there's no way that...
Yeah, but it's not going to mean you have any contact with her personally, is it? You won't have to talk to her at any point.
Can I put something to you? This, you might feel I'm twisting your arm here a bit, which I am a little bit, but can I just put a thought to you? I know you said that your sister had had a couple of babies herself, so I wanted to roll forward about 20 years from now, and if you open the door one day and there's a young woman there holding a baby with a severe malformation and said, "You're my uncle," and I've just found out that you knew that this might happen, how will you answer that niece?
You've got the opportunity to change that now. I just don't know why you're not doing it.
Just because I
don't want to know why. Clearly there is things happened in your family that I don't need to know about. What I'm saying is that it's not just you and your sister. This is actually other people's lives are potentially involved here as well. And I think, if you imagine how you would feel as a couple... I don't see
why I should help her.
I'd like you to go away and think about this, because it's actually really quite important, not just to you and Selena and your sister, but to your sister's family and their family. I mean, this could be something that would come back to bite us 30, 40, 50 years from now. And that's the real issue here. I think this is, your sister's probably finished her family now, but her children are going to grow up and could be carrying this translocation. So I think it's an issue you need to think very hard about.
And you have no issue with them?
We don't need to decide this now. I'd like you to go away and think about what I've said, because I think it's a very important topic. It's very important for you either way, I understand that. And I wouldn't ask if I didn't think it was important to the other members of your family. But as I say, the thing to take away with you is this is not going to involve you talking to your sister, and it isn't benefiting her necessarily. It's actually for people you don't even know.
So if you were to speak to her, would you tell her what's happened with us, or would you keep that?
We would need your permission to say that we have found in her family this chromosome rearrangement, because otherwise why would I contact her?
It's fine with me.
Let's leave it and leave you to think about it. I'm going to send you a letter, and I'll send you a reply slip, and if you decide that you want me to do this, then you sign that, give me the contact details, and we'll do the rest. That is a true story that I was confronted by several years ago. I never did find out what it was that made Dominic so fearful of, or positively against, contacting his sister, but we can all imagine that there are all sorts of stories behind this sort of position. We can't ultimately breach the confidentiality of the families that we meet. We have to work with them. But I think it's very important that we also confront people with the consequences of their actions, and sometimes that doesn't immediately spring out. In the true case that I dealt with this, the person involved relented and gave me the address, and I think that was the right outcome. But it is very difficult. This is a situation where being non-directive carries significant consequences, and so there are occasions in a genetic clinic where you might have to lean on people a little bit and try to get them to do the right thing.